Welcome back. This is the second video of the 10th class for social psychological perspectives on health. In the first video, I talked about how depression may be explained in the cognitive behavior model. And in this video, I will talk about the interpersonal stress model. So what precipitates a depressed episode? The traditional research would argue that that is related to attachment theory. So basically, early life interactions with caregivers are internalized and influence social interactions, and particularly in family and intimate relationship throughout the lifespan. So in a sense, I think this is kind of similar to what the cognitive behavioral model talks. It says that the stressful early life events sort of determine the core beliefs about oneself and the others, and that uh, guide how people think, feel, and then behave. So interpersonal trauma such as violence, emotional abuse, insult, humiliate, and then that instilling fear would lead to future depression by undermining social trust and hindering the development of appropriate social relationship. So this model kind of focuses on how wrong or bad relationship with others in early life determines how people would interact or trust others. And because those who had very stressful interactions in early life cannot trust others, and then also cannot develop appropriate social relationship, and then that would lead to future depression. However, it doesn't have to be trauma, but any life stresses could lead to depression. So you may remember the social readjustment rating scale, and then if you look at the scale closely, you may realize that in the higher rankings, most of the event in the higher rankings actually are about loss of the important others or change of yourself, like death of spouse, divorce, marital separation, marital separation, and then death of close family members, and fire at work. This is like something related to life transitions, and retirement definitely. And yeah, so as you can see on the top 10 rankings, like 1, 2, 3, 4, 5, 6 are related to the loss of significant others or change in the self. Losing something or someone, like divorce, bereavement, and retirement, can be a stressor that triggers depression. When people are particularly vulnerable and need help most. So basically, when people lose something or lose someone, this is a time when people are particularly vulnerable and need help most. This depression is not unique to a certain type of person, but could happen to anyone under certain life circumstances, such as losing something or someone. And in such situations, if they cannot receive or benefit from adequate social support, then they may be likely to develop depression. So there is a hypothesis which is called the stress buffering hypothesis. And this argues that not everyone develops depression under certain life circumstances. Not all the people who lose important others or who lose their important jobs would develop depression. And then this hypothesis tries to explain why it is the case. The hypothesis argues that those with access to social support would not develop depression. And this study the title of this study, which is the lack of social support and incidence of coronary heart disease in middle-aged Swedish men. Okay, this is not about disease, but hold on. Yeah, okay. This isn't about depression, but this is about coronary heart disease, which I guess is very much related to the levels of stress. And this figure indicates a 6 years incidence of coronary heart disease by social integration. So the far left, people in the far left had the least social integration, and the middle degrees of social integration, and the high level of social integration. So the researchers categorize people into three based on the levels of social integration. And example items of social integration is that such as like number of people with whom respondents share interest, or number of friends or family members with whom respondents can talk frankly, and some available whom respondents can ask small favors. So this is pretty much about how many people they can get social support, like maybe practical or emotional social support. And then as you can see from the figure, those who had this social integration had higher percentage of having coronary heart disease, and the relationship with the social integration was linear, indicating that the more they have the more they have social integration, or the more they have social support, the less likely they would develop coronary heart disease. So basically, social integration, no, sorry, the stress buffering hypothesis indicates that even if there is a stressor, if people have adequate social support, or if they are socially integrated, they are less likely to develop stress-related disease, such as coronary heart disease or depression. However, as it is always the case, there is a limitation in this hypothesis. So this is what often this hypothesis predicts. So when the level of stress is low, regardless of whether they have high social support or low social support, doesn't matter in terms of their mental health. So like those who have high social support, they score about 5 on mental health, and then those who have low social support would also score like 4.7 on mental health. However, when there's a high stress, those with high social support still rate very high or good mental health conditions, while those with low social support indicates very low mental health condition. So this is a typical figure that shows the stress buffering hypothesis. So basically, this argues that social support buffers the impact of stress on mental health. However, the specific interaction between social support and stress does not predict mental health outcomes well. So basically, there's not much study that supports the hypothesis. For example, Burton and others demonstrated with their meta-analysis that 3 out of the 58 studies supported the interaction. Like it's about maybe what 5% of the studies maybe supported the stress buffering hypothesis. And then the authors of the textbook argues that there are direct relationship between social support, perceived stress, and mental health. So the stress buffering hypothesis argues that when there is a perceived stress, the impact on mental health will be moderated by social support. However, the authors of the textbook argue that these 3 factors are related to each other, not the one being moderating the relationship of the other 2. And furthermore, the authors argue that the levels of social support and then perceived stress are the outcomes of social identity loss, like this model indicates. So when people lose their social identity, like retirement from their job, they lose their social support that they used to have at workplace. And then the change in their life would be perceived as a stress as well. And also the loss of social support would lead to increased perceived stress. And this loss of social support and then perceived stress would result in poor mental health. Okay. And the authors of the textbook also argue that this is consistent with the social identity model of identity change. So when they have a life change or transitions, if they can maintain group membership, then they would have better health and well-being. But if they cannot maintain group membership, then they would have lower or worse health or poor well-being. Okay. So social relationships do not moderate the effect of stress, but their absence is a cause of poor mental health, depressive condition. Okay. I think the key point here is that the stress buffering hypothesis is not well supported. And from social identity perspective, the loss of social support and perceived stress can be understood as the outcomes of social identity loss. And you may want to remember the appraisal theory. So how they apply the stress would be dependent on how much they can feel that they are a member of a group. And then if they feel that they are a member of a group, then they can feel more control in their life. And then they would be rely on the social support from their in-group members, and thus they would perceive less stress, and that should lead to better mental health. Okay. So direct relationship between social connectedness and depression, an increase in loneliness and accompanying social withdrawal precedes rather than follows the development of depression. So remember the definition of depression, which was which includes social withdrawal. However, some studies suggest that actually social withdrawal precedes the development of depression. So as I said, biochemical and cognitive behavior models conceptualize social withdrawal as a symptom or maintenance factor in depression, but some studies demonstrate the contradicting results. So if the loneliness induces withdrawal, which may result in depression, what life conditions make people feel lonely? And one line of research argued that is social skills. So those who lack social skills would show social withdrawal. So basically, if they are not confident in their social skills, they may do not want to interact with others because they don't want to feel ashamed, And so, why people lack social skills? What make people lack social skills? And so there is a question, but the interpersonal psychotherapy targets the improvement of social skills. Basically, yes, loneliness may be one of the causes for depression. And in order to remove such cause, maybe it is important for people to be socially integrated. And in order for them to be socially integrated, they need to improve their social skills. And that's interpersonal psychotherapy targets the improvement of social skills. Okay. And so basically, this psychotherapy trains people to change ways of thinking and think realistically. This is actually pretty much same with cognitive behavioral therapy. And then interpersonal psychotherapy trains people to consider behavioral options people can take. Oh, for example, in the case of this example, you said hi to your boss and then your boss ignored you. And then you may think that, okay, my boss hates me and I never get along with coworkers and thus I would just never say hi again. However, maybe even if you think in a similar way, you still can take different behaviors, such as you may say want to hi louder, this is an alternative behavior. So basically, interpersonal psychotherapy trains people to consider alternative behavioral options. Okay. And then, saying hi louder instead of avoiding eye contact is one of social skills, I guess. However, this psychotherapy fails to take into account the role of social processes. In other words, the best way to develop interpersonal relationship is to define the self and the others as members of the same group, perceiving others as in-group members or as a part of self. So, what makes people lack social skills? This was a question, but this was not a right question. Why people feel that they lack social skills? I guess this is more appropriate question to be asked. In what situation people feel that they do not have right social skills to interact with others? Maybe you may want to think a situation where you have to talk with somebody. You have no prior knowledge about him or her. You would definitely think that the interaction will be awkward, and that is because you don't know about him or her. You don't know what would be the commonalities between you and others. right? But if you are interacting with someone from your group, then maybe you have some ideas about what you may want to talk with, or you have more, more commonalities shared between you and others, then you would have more topics to talk with, right? So social skills is not context independent, but rather it is more like context dependent. And then people would feel that they have more social skills, or maybe they even don't think about social skills, but still they can interact with others more effectively. And that's when people are perceiving others as a member of in-group. So the shared social identity helps people to feel that they actually have a better social skills. Okay. So the social identity approach to depression. The goals of the social identity approach is first to integrate a clinical account of depression symptoms and a social psychological account of the nature of social relationships, and is to explain how and why stressful events such as social loss, trauma, and social isolation appear to trigger depression onset and relapse. And also it tries to explain why CBT and IPT, interpersonal psychotherapy, I guess, yeah, might work well. So remember, these two psychotherapies actually work better. Well, it do work. They do work, But it seems that the reason why they help people to treat depression, the explanation behind that may be not so right, It needs to be reinterpreted from the social identity approach. Okay, one more, I think. So social relationships counter depression when they inform the self-concept. So we have learned that the recept of social support is not related to well-being, but perceived social support, how much they perceive that they are socially supported, is related to well-being. And here it's kind of similar in a way that social relationships do not always counteract depression, but they do when they inform the self-concept. Turner says that Turner, who is the founder or of self-categorization theory, who first originally proposed the self-categorization theory together with Tashov, who proposed social identity theory, said that we understand ourselves not only on the basis of what makes us unique and different from others, but critically on the basis of what we have in common with others. So the first part, we understand ourselves not only on the basis of what makes us unique and different from others, is more like a psychological perspective. It defines how an individual is unique and different from others. But we also define ourselves in terms of how much we have in common with others. And this is a social identity perspective. So we understand ourselves through the lens of how we categorize ourselves together with others, which is self-categorization. So if we categorize ourselves as Hitotsubashi University student, that would be very much different from categorizing ourselves as Japanese or as workers at respective part-time workplace, So depending on how you may categorize, the understanding and definitions of yourself would be very much different. Okay, and social relationships would have implications for our health and well-being when they give us a sense of social identity, a sense of who we are. So in chapter 2, we talked about why social identity is important for our health, and that is because social identity gives us a sense of control and meaning and purpose. So there is one study which showed that joining social groups reduced the likelihood of experiencing a first episode of depression. So basically, if you join groups, social groups, the likelihood of never having depression in your life would increase. Okay. And not only that, at the beginning of this class, we learned that about 80% of people who are diagnosed as depression would have a relapse in their life. But if people join more groups, they would have less. They are less likely to have a depression relapse. So on the x-axis, it indicates the number of groups they gained in 2 years after the depressed episode. So zero means that in 2 years from the initial depressed episode, they have never joined the new groups. And then one is that they joined they joined one group after the in 2 years, and 2 and 3 and so on. And on the x-axis, it indicates the percentage of people relapsed at wave 5. So as it is clear from the figure, the more they join new groups in 2 years, the less likely that they experience relapse. Okay. So not only that joining social groups reduces likelihood of experiencing a first episode of depression, but also joining more social groups reduce likelihood of having depression relapse. And indeed, this study, I guess, indicates that a therapy that focuses on building shared social identities and shared group memberships would be more effective than one improving interpersonal relationships. So interpersonal relationships, interpersonal psychotherapy focuses on developing social skills in one by one, like one-on-one basis. So they develop social skills that they can have a good interpersonal relationships, and they do not consider about how belonging to a shared group, belonging to a common group would influence their feeling and understanding of their social skills. But this social identity approach suggests that even if you do not train your social skills, if you belong to more groups, and then if you are communicating within that group with the sense of shared social identity, then whether you have adequate right social skills or not would not be a problem. You would just enjoy a good interpersonality relationships. Okay. And then such positive interaction within a group should help people to reduce the likelihood of having depression, and even reducing the likelihood of having depression relapse. Okay. All right. I think I will just stop here, and then in the next class, I will keep going through the chapter 8, and then, okay, I will finish in the next class. The chapter 8, depression. Okay, thank you very much.